If your child has an illness or injury requiring hospitalization, he or she may be cared for by a pediatric hospitalist. I'm joined by WVU Medicine Camden Clark's pediatric hospitalist, Dr. Jordan Beckett, to learn more about pediatric hospitalists. Dr. Beckett, thank you so much for sitting down with me.
Thank you so much for having me.
Of course. So the first question, we want to learn a little bit more about pediatric hospitalists. So can you just tell us about what that role is, since that's what you do?
Absolutely. So in short, a pediatric hospitalist is a pediatrician who takes care of hospitalized children. So that could be a brand new baby when they're first born, or it could be a sick toddler, infant, or teenager.
Right. Okay, and so I do want to talk to, in the hospital setting, what exactly more so besides just maybe those things? Are there other things within the role?
Absolutely. So here locally, I have the privilege of caring for kind of two different types of patients. So in our newborn nursery, I care for, our little ones as they're firstborn. Sometimes I'm called to, attend high-risk deliveries if either our nursing staff or an OBGYN feels like, I need to be there. So, I care for, brand new healthy newborns, and sometimes whenever babies come out, they kind of need a little bit of help, whether that's with IV fluids or oxygen or respiratory support. I'm able to provide that care for them. And during those first couple days of life, parents have so many questions, and I love being able to kind of be there 24 hours a day to kind of navigate all those questions and concerns. So that's kind of our newborn role. So in terms of pediatrics, I care for, whether it's a toddler or an infant or a teenager. If you're sick in the hospital, I care for those kids here locally.
Right. All right, great. So I do want to ask too a little bit about the history of the role now nationally and locally, if you can just tell us a little bit more about kind of how it started.
Absolutely. So here locally, we've been around about 10 years. So our program started out with only about 2 physicians, and now it's grown so that there's a total of 5 of us here locally.
Oh, wow.
Yeah, so we're able to provide 24-hour care for any child who is admitted to the hospital here locally. So, across the country in pediatric medicine, just kind of how it did with, our adult medicine colleagues, over the last couple decades, whenever children or adults got hospitalized, that kind of shifted from, your typical pediatrician or family doctor caring for you both in the office and in the hospital. So, for the most part, across the country and here locally, hospitalized children are cared for by a pediatric hospitalist like myself.
Absolutely. And so I want to talk about it too, pediatrician versus pediatric hospitalist. What is the difference between both of those roles?
Great question. So a pediatric hospitalist, like I said, cares for typically only hospitalized children or only sick children, with the exception of those, brand new healthy newborns. Right. That is our job. Our pediatricians are on the front lines out there. They are the ones doing all those super important well child visits, all those ones where they're, just discussing growth and development and giving you those, essential vaccinations. They are the ones out there, trying to, talk with families. They're the ones meeting with them and deciding, is that kid okay to be on the outskirts of the hospital, or is your child sick enough that they would need to come into the hospital setting?
Absolutely. And so I do want to ask too, what is usually the age range of kids and the typical conditions that someone as a pediatric hospitalist yourself, you might see on an everyday basis when you have someone come in?
Great question. So, like I said, newborns, whether they are 35, 36 weeks premature and up, we care for them. And then also babies, whenever they potentially go home from the hospital or come back, all the way up through the ages of 18 years old. So in terms of typical conditions, on our pediatric side, we care for things like dehydration, pneumonia, asthma exacerbations, bronchiolitis, skin infections, stomach infections, so a wide variety of things. And what's awesome about being here is that if I would have any questions that say a patient would potentially need the care of a subspecialist, like say a pediatric cardiologist or a pediatric infectious disease doctor, I can call them and they're able to either consult and look at the images and look at the lab work. So we're able to care for a wide variety of things here locally, which is awesome for, our families, because it's so important. As a parent myself, if your kid is sick, you want to be close to them. You want to be, with them. You want to keep being able to, go to your jobs as needed. And many times, children's hospitals are hours and hours away from the parents. So, here locally, being able to provide that care for these families here is critical.
Absolutely. And so before I let you go here, I do want to ask, is there anything that you want to tell us more about the role or just about what you do in general as a pediatric hospitalist?
Absolutely. So in addition to the things I've mentioned about, caring for kids within the hospital, I love keeping up our relationships with the pediatricians in the community. So, if you're a pediatrician and you're concerned about a child, they, pick up the phone, call us over here at the hospitalist department. We try and really, make sure that from the pediatrician's office into the hospital, back into the pediatrician's office is, a seamless transition that we would like to, everyone's on the exact same page. We just want to make sure that whether it's the pediatrician, the pediatric hospitalist, myself, the parents, the child, everyone is all on the same page. Everyone's questions are answered, and just really that whole kind of family system that's extremely important in pediatrics. That's kind of the biggest, and probably I would say the best thing about my job is that you can still keep your perfect relationship with your pediatrician who gives your child all their vaccines, but whenever your kid is sick enough to be in the hospital, I'm the one who cares for them, and then I can give everything back to the pediatrician and tell them exactly what happened during the hospital stay.
Absolutely, and it's truly beautiful to see how much, I can just tell from when you talk about it, how much you really do love your job every day and helping kids here in the Mid-Ohio Valley, feel better after they're dealing with an illness. But Dr. Beckett, thank you so much for sitting down with me and sharing a lot on this topic. But in 2 weeks, we'll get to hang out again and you'll get to share a little bit more about pediatric hospitalists, and you'll have some advice for parents as well.
Thank you.
Of course, when we return Mid-Ohio Valley, we'll have one last look at your forecast. Stay with us.